Hello, my name is Dr. Alexandra Chebil. I'm a Lasik surgeon at the Lasik Center Medical Group in Irvine, California. And what I do is Lasik, and that is to correct people's vision, whether you wear glasses or contact lenses, and if you have nearsightedness, farsightedness, astigmatism, or if you have close vision problems, typically the Lasik treatment is a good option. You do need to come in for a free consultation to determine if Lasik is a good choice for you. However, some people don't want to take the jump and come in. They don't want to make the commitment. They don't have the time. So what I would like to do is cover a few issues, concerns that people may have before you decide to come in for your complimentary consultation. And what I would like to tell you about today is the possible downtime after Lasik. People are concerned, they're working, they have to drive, they have children, go to school, etc. And they'd like to know, it's a natural concern, what is the downtime after Lasik? To begin with, you do need to leave your contact lenses out for 1 week if you're wearing soft contact lenses, and 2 weeks if they're lenses for astigmatism. They're called toric lenses. So that's the front end downtime. Secondly, when you come in, we do a free consultation. If you are coming from far away and you don't have a lot of time, we can do the consultation and the Lasik treatment the same day. As long as you have a driver and you've been out of your contact lenses for the 1 to 2 week period, then I'm more than happy to do the consultation and the surgery the same day. Once you've had the treatment done, which takes approximately 1 hour here at the facility, then this is where we'll go into the typical downtime after Lasik. For the first 4 hours, your eyes will feel scratchy, burning, and tearing, and that's typically very normal. It's usually not bad enough that people feel the need for painkillers, anything stronger than Tylenol. If you're very sensitive to pain, discomfort, then we will certainly call in a stronger painkiller for you, but for the most part, Tylenol is sufficient. After those first 4 hours, where your eyes are quite light sensitive, your eyes should feel quite normal. So the next day, it is important to come in for your 1-day follow-up visit. That's the most important visit. And for the most part, patients that I've treated over the past 25 years, the vast majority have been able to drive themselves in without glasses or contacts for that 1-day visit. So that's the initial downtime, is the first 12 to 24 hours. You will have drops that you'll have to use for the first 5 days. These drops will not blur your vision. It's an antibiotic and an anti-inflammatory drop, as well as some lubricating drops to be used approximately every 4 hours. We have all of this written down in detail, so when you come in for your consultation and your surgery, you will be given a detailed instruction sheet that you can take with you. After the initial discomfort, you use your drops for the 4 times a day for 5 days, and I see you back for the 1 week follow-up. And this is also very important. I give you a little certificate that you can keep for the DMV, and it says that you meet the DMV requirements to drive without glasses. People have other questions about downtime regarding work-related issues, makeup, sports, etc. Very important questions. First of all, ladies, you should not wear eye makeup for 1 full week after the procedure. And when you do start wearing makeup, especially around your eyes, it's important not to wear the waterproof types that require a lot of rubbing to remove them. So start very slowly with the eye makeup only after 1 week. If you are involved in a lot of activity that involves dust and dirt, for the first week, it's best to stay out of dust and dirt, and after the week, wear protective glasses just so that nothing dirty, no dust gets in your eye for the first month. And this is just so that you don't feel the need to rub your eye and possibly cause an infection and damage to the flap. If you're doing sports that involve water, for example, scuba diving, swimming, or if you use saunas a lot, it is important not to engage in that type of activity for the first month after treatment, especially opening your eyes underwater. If you're doing any type of snorkeling or swimming, it's best to wear goggles for the first month after the treatment, just so that you don't get anything in your eyes. Other than that, if you are involved in contact sports, for the first month, please avoid those, and after that, wear protective glasses for the next month after that, just to avoid any kind of trauma to your eyes. Regarding driving, as I mentioned, almost every person that I've treated over the past 25 years has obtained at least driving vision on the first day after treatment, and it's actually typically more like 20/20 right after surgery, and that's what I expect for you, hopefully. If you have your treatment done for a reading problem, then typically my patients will be able to read the first day after treatment. It may be not totally sharp, it's not like putting on a pair of glasses, but you will be able to read, and it just gradually sharpens up. When is your vision final? Usually it's at 3 months. Even though people see 20/20 for the most part on day one, the vision can continue to improve even up to 3 months. So don't worry if it's not 100% crystal clear right after the treatment. That will sharpen up even up to 3 months. Now, the follow-up care, you do need to have eye drops, as I mentioned, the antibiotic and anti-inflammatory for the first 5 days. And after that, you will need lubricating drops, probably for the first month or so, just until the surface of your eye comes back to its natural moisture level. So overall, the LASIK treatment is extremely fast. The whole treatment is only 10 minutes for both eyes. It's pretty much painless, virtually painless, maybe a little bit of pressure and a little scratchy feeling for the first few hours after the treatment. But the downtime is very, very small. The majority of my patients get back to work and they get on with their lives, driving, sports, vacation, having fun the day right after the treatment. So I hope you'll take the time to come in for your free consultation. We'll go over all that with you, and I have a lot of trusted staff. My staff has been with me now for 9 years, and they will go over every possible question that you may have. So we hope to see you soon. Bye-bye.